I found out one of my patients died this week, and we're all really sad about it. And I thought I would do a video just about how cool she was and why we're all so sad. So this patient was an absolute firecracker of a person. Her personality was so huge and so fun. And every time she was in the office, she was here for 2 hours because every single person would grab her and want to talk to her. She was just such a special soul. And my heart is just devastated that she's not with us anymore. But she said a bunch of really poignant things over the last month or so as her end of her life was nearing. And I think it's kind of nice to share with people about why some of us physicians have the perspectives we have about patients not choosing standard care. All cancers are terrible. We hate them all. But there's some that are easy to treat and can be a slam dunk. With breast cancer, that's most of them that I see. And then there's some that are incredibly difficult to treat, and there's just nothing that can stop them. This lovely soul had one of those monsters that nothing could stop it. And she did everything right. It was caught early. She saw all the right doctors. She did chemotherapy. She did radiation. She did surgery. She did close follow-up. She enrolled in clinical trials, and it wasn't stoppable. While she was going through this treatment and having her sweet little body just beat to hell, she was part of these support groups online. And there is a lot of well-meaning people that oversimplify cancer treatment and would make her feel as though the cancer was spreading or not being managed because she wasn't doing things right. And like I said, she was doing everything right. And often the right things these people would suggest are not proven alternative treatments. And it was really frustrating and upsetting to her because she was literally fighting for her life. And these people were implying to her that if things weren't going well, it's because she was doing wrong things and she should be doing these other things. And she said it was hard to watch. It was hard to watch people make bad decisions when they had cancers that she prayed she could have had. She watched people make decisions based off of recommendations from non-experts in these groups that ended with bad outcomes. And underneath it all, she said she would have given anything to have had one of those easy-to-treat cancers. So she left the groups. She said they weren't helping her, and it was hard to watch people advocating others harming themselves. And I think as physicians, it's really hard to watch people make decisions that are not ideal. And as this story tells you, not every patient makes it through treatment. And it's not because the treatments were wrong. It's because the cancer was a monster. Cancer is complicated. Medical problems are complicated. They're not simple. And it's not as simple as do the right thing, you won't get cancer. Do the right thing, your cancer is treated. It doesn't work like that. And to oversimplify it really harms the people that are fighting for their lives and doing all of the treatments we have available and still don't beat it.